I have had a kidney pancreas transplant and it's changed my life.
Rizwana Ramzanelli was diagnosed with diabetes at the age of 9. 20 years later, the long-term effects of the disease caused her kidneys to fail, a dreadful situation that forced Rizwana to make several changes to her daily routine.
I really struggled with the fluid and diet restrictions because I had absolutely no kidney function. Every time I cooked, I had to take out my food separately and so my family could have a decent meal.
In March 2004, Rizwana was listed for a double organ transplant and had to endure dialysis treatments 3 times a week. 5 months later, the call she had long awaited for arrived. Organs had been matched and a surgery would happen.
Since the transplant, I haven't needed another insulin shot since then, or neither have I needed another treatment of dialysis. It's just absolutely wonderful.
The government has asked Canadian Blood Services to develop a recommendation for a nationally integrated system for organ donation. Vice President of Strategy Management, Sophie Devlin, helped facilitate the first of several nationwide public dialogues here in London last weekend.
We want to hear public's opinion. We want to give them an opportunity to voice their opinion on what this new system should look like and how we can do better.
Co-director of the Kidney and Multi-Organ Transplant Program at London Health Sciences Centre, Dr. Tony Jevnikar, addressed several concerns to the anxious crowd at the public dialogue. He firmly believes that one crucial problem is the failure for individuals to recognize this issue.
So one of the problems, of course, is to try to get Canadians to kind of think about this, to understand that there is a problem, that there is 4,000 people on the waiting list, that hundreds of people die waiting for an organ, and that we haven't met that challenge.
Right now in Canada, organ transplantation is provincially funded and provincially run. Dr. Jevnikar believes that Canada needs to use a nationally integrated system to help save lives.
Organ failure happens whether you live in Quebec or Ontario or British Columbia, and the solutions to organ donation need to also be nationally.
Beauty not only resonated within the elegant setting of the banquet hall that day, but also in the powerful speeches and meaningful discussions that filled the room. There are several concerns involving Canada's current system for organ donation and transplantation. A lack of public awareness and national coordination are only 2 of the central problems, but there is one other major issue that we could all perhaps help out with.
We just simply do not have enough donors. And so what that means is that a number of people are waiting for years on wait lists, waiting to have access to an organ.
One remarkable individual was lucky enough to receive a second chance at life. Heather Fisher was saved by a donor family.
Truly, I would have died 26 years ago had I not had the liver transplant. And because of having the transplant, I've just had an extraordinary life.
Heather has been an acute pain service nurse at the London Health Sciences Centre since 1984. This summer, she conquered breast cancer. Even though she endured chemotherapy treatments and faces physical hardships, she continues to tell her personal transplant story.
I was actually sick when I was 14 years old and never got better from my liver disease at that time. The liver is the only organ that actually can regenerate itself, but I was so ill that it damaged it. 15 years later, I hadn't gotten any better, in fact worse, and so I did need to have a transplant at that time.
Heather is the second longest surviving liver transplant recipient in Canada. When London was just beginning to offer organ transplantation as an option, Heather was next in line.
They'd done 4, 1 had survived, and then I was the next one on the list. So, scary times then.
After surpassing the odds, Heather has dedicated much of her life to organ donation awareness. She has several extraordinary accomplishments, such as climbing 15,000 feet to the top of Mount Kilimanjaro, competing in the World Transplant Games, and helping to organize the world's biggest walk. She strongly believes that providing Canadians with information regarding organ donation is essential.
Education is just so key, making sure that people understand who would be able to give their organs, who couldn't, why they couldn't, and why it's so important to give your organs.
London sets an example for other cities in the country, as it is the first to implement a program for the high school curriculum that deals with the issue. The organ and tissue donation coordinator for the Trillium Gift of Life Network, Barbara Van Rassel, constantly speaks out to grade 11 students, hoping to raise awareness.
We know there is tons of research out there that it really does benefit the families to say yes to organ donation.
Last year, 215 Canadians died on the organ transplant waitlist. Barb adamantly makes an appeal to the public.
Sign a donor card, sign a registry, go home and talk about it with your families. Let them know what your wishes are.
I'm Melanie Anderson.